Welcome back to the Success Portal, and a big shout out to all my new subscribers. I really appreciate you for watching my videos and subscribing to the channel. Today we're going to be talking about the 10 lessons that we learned from this pandemic. Well, the first thing that we have learned from this pandemic is that small things matter, because a minute microorganism by the name of SARS-CoV-2 has caused so many people to stay indoors for many months on end. Something that is microscopic, something that you can actually not see with your physical eyes, has caused a lot of job losses. It has also caused loss of lives, both directly due to the COVID-19 and also indirectly. So small things do matter. And I want to say to you that little things that you do in your life to improve your life have actually got a big effect over the long term. Another lesson that we derive from the current pandemic is that life is valuable, and most of the time we become very busy and we actually don't pay attention to small things. Just for example, when you wake up in the morning, appreciating the sun rising, appreciating the birds chirping outside, you lose that touch with nature and the surroundings and your surroundings. So one thing that the pandemic has taught us is to have an appreciation of life, appreciating the small things. Another thing that we have learned is to be grateful. And I know, for example, each and every single day that I woke up in the morning, I was so grateful to be alive. I was so grateful to be able to breathe and to be symptom free, because in my line of work I actually did work with patients who were COVID positive, and I could have gotten infected quite easily. But I was so grateful each and every day that I woke up in good health. And good health is something that we kind of take for granted. But in this pandemic, I saw quite a number of people dying, and that suddenly just comes to you, and you begin to feel to yourself that this could be me. This could be me struggling to breathe. This could be me on oxygen. This could be me on a ventilator. But I am walking. I'm alive. I'm healthy. I'm able to exercise. I'm able to eat. I'm able to do my activities of daily living. So I learned that in this pandemic, we ought to be grateful. Not just because we're going through a crisis and because other people are dying, but being grateful for being alive each and every single day. Another lesson that we learned from the current pandemic is the importance of financial planning. I know quite a number of people who went through financial strain as a result of the pandemic. Some people were not able to work. Some people who are entrepreneurs were not able to open up their businesses because of the lockdowns that the government imposed. Some people lost their jobs. It was quite a difficult situation for the entire world financially. So the pandemic has taught us the importance of saving, and financial planners have been preaching this for a very long time. The importance of saving up 3 times your income in case of running into a crisis along the journey of life. So people who didn't have savings suffered a lot during this pandemic. And we also learned in terms of financials how the virus affected stock markets. At the beginning of the pandemic, we saw oil prices begin to plummet to all-time lows. It had not happened in so many years. We saw gold price beginning to skyrocket. We saw the price of silver going up. And we also saw cryptocurrencies beginning to pick up momentum. And there's beginning to be more appreciation of cryptocurrencies and digital currencies at the moment. I'm not a financial advisor, but I would say to you, it's worth looking at cryptocurrencies because they are poised to go higher and higher. The other thing that we got to learn from this pandemic is that things are not always the way they seem. And being an academic, I get to read articles and also read around the subjects. And in my department, we really looked at a number of papers that discussed stuff about the SARS-CoV-2. And it was quite interesting that in journals, which I'll not mention in this video, established journals that are known all over the world and have high impact journals, were publishing fraudulent articles. There was a particular article that was published talking about the hydroxychloroquine and also chloroquine and azithromycin being toxic. And that article ended up being withdrawn because the authors of that article presented fraudulent results. And these people were not just ordinary health practitioners. These were established researchers. And it was actually daunting that established researchers would propagate fraudulent information just in order to publish an article and get known during the pandemic. There were so many articles that were published during this pandemic. Some of them were not correct, some of them were fraudulent, some of them people were just pushing to publish so that they would make a name for themselves during this pandemic. And there's something that us scientists have spoken about during this pandemic. We call it an infodemic, where there is a lot of information going out there, information that has not been filtered, information that has not been properly tested and evaluated. So you'd find that researchers would run to the media to present certain information that they'd come up with without actually validating this information with fellow scientists or the medical fraternity to see whether their findings were actually correct. And what would happen is that the media will run all these tests and run all this information and spread all this information, which would later find out that was actually inaccurate. And members of the public will start acting based on that information, which is incorrect. So we learned a lot from the pandemic that sometimes things are not always the way they seem. And you need to, as a member of the public, read stuff, scrutinize stuff. Don't believe everything that you watch on TV or hear on radio. Always scrutinize things, think things through before you act on what's being said on social media. The other thing that we got to understand during the pandemic is that a crisis exposes inefficiencies. And being in Africa, our health systems here, where some of them were not prepared for something like this coming the way of the different countries in Africa. So it exposed the different inefficiencies in the health systems. These inefficiencies were already present in the system, but because of the pandemic, they were accentuated. And it really exposed the lack of competency of leaders, because in a crisis, that is when leaders should rise up. And that's another lesson that we learned from the pandemic, is that a pandemic or a crisis is where true leaders are made. And unfortunately, we just realized that we have only got nominal, quite a number of the leaders are mainly nominal leaders, because they are not strategic thinkers. They do not think in the future. They are not visionaries. They are just mainly people who are reactional. They are not proactive. They just act based on what happens in the present, and they actually don't have plans concerning the future, concerning the economies of the different countries and the future of their people. The other thing we got to know during the pandemic is how there is such a rise in opportunists. And some of these opportunists they are both positive and negative opportunists. Positive opportunists is people who took advantage of the opportunities that were there in the market. For example, because vitamin C has been noted to be a potent antioxidant, many people who were into the farming of citrus products made a huge profit during this time. And we know, for example, Zoom platform, which is a type of online conferencing platform which allows people to interact real time online, made huge profits at this time because people could not meet because of the social distancing procedures and protocols. So they had to meet online, and Zoom managed to make a lot of profit. The stock, the Zoom stock skyrocketed during this time. But there were also negative opportunists, people who were into corrupt practices, who took advantage of the pandemic. Some of them, especially here in Africa, people stole a lot of money through PPE funds, and a lot of money which was designated to help the poor, the suffering, people who could not afford a meal because they could not go out and work during the pandemic, actually ended up suffering quite a lot because this money was stolen by corrupt leaders. And some people used the pandemic to enrich themselves. So we saw these things happening which were quite disconcerting. So this is what the crisis revealed to us, and it really makes us to think twice when we choose our leaders and when we trust certain individuals to handle certain funds. So it was a learning process also for the government when it comes to assigning people certain contracts and tenders at this time. Another thing that we got to learn during the pandemic is that the human race is not invincible. One simple, small microorganism caused a whole lot of panic, and we thought it was really going to cause many people to die. That didn't happen, though quite a number of people did die, and I do sympathize with all the people who lost their loved ones during this time. I know people who actually did lose their loved ones. It's quite painful. Many people passed on because of this virus, but not such a huge percentage wise in terms of the different government global populations. But those who lost their loved ones, even if the mortality rate was 1 or 2%, when you lose your loved one, even if people say it's only 1%, but for you the loss of your loved one it means the world. It's almost like 100% for you, because that person had played a significant role in your life and you love that person. So I really sympathize with those people. But we did learn from the pandemic that though we are technologically advanced as the human race, there are things that we are not yet invincible to. And for example, this type of sickness, up to now there is no cure for COVID-19, and scientists have been trying to come up with a vaccine, and that has not. There's no solid information concerning that vaccine, whether it's ready to be rolled out or not, and whether all the tests have been done so that it can safely be administered to the general public. So this is quite a humbling experience for the human race to say, hey, we're not yet there yet, and we should humble ourselves because we still have a... Another thing that we learned from the pandemic is the need for self-development and the need to evolve, because you kind of just realize that just over a day or over a month, you could end up jobless. So you need to be quite adaptable and be quick to evolve, because you might find yourself not having a job. So you need to do something which is going to allow you to be employable, or you should always have in mind that if you get to the point where you're not able to get a job, you should be able to kind of start your own thing, become an entrepreneur, become your own boss. So the pandemic has taught us that, the need to innovate, the need to think out of the box, the need to evolve in order to survive. The last lesson we learned from the pandemic is the importance of faith and hope. When there is no current cure and medical interventions do try and prolong the life of those who actually contract the virus, but though their lives are kind of prolonged, maybe for a week or 2 weeks, but some of the patients don't actually make it. It's quite a humbling experience for those who are in the medical practice, because we're supposed to offer hope to patients, and as a medical practitioner, your hope is to be able to solve a problem, to be able to treat a patient, and to be able to see that patient get better, get off the bed, be discharged, and go back to their normal life again. But sometimes that did not happen in this pandemic. Sometimes the moment the patient entered the hospital, that was the last time they ever walked again. That was the last time they ever saw their loved ones. So it was quite a painful experience for families and also for healthcare professionals, because having taken care of a patient for like 2 weeks, 3 weeks, I can honestly tell you, you become attached to that patient. Though you try not to be, but you become attached to that patient. And when eventually that patient dies, you feel like you've lost something, you feel like something has been taken away from you, so, and it can actually become very stressful, especially if that same circumstance repeats itself like 2 or 3 times. You take care of patients for 2 weeks and you lose them after all the hard work and all the emotional effort and all the physical effort that you've put in. So sometimes it can be quite draining. And that's the importance of faith and hope. When you go through the pandemic, I learned how important it is just to have hope, to say, you know what, things may be like this today, but I have something inside of me which says better days are ahead. And as I'm making this video right now in September, the second week, I know that the pandemic is still ongoing, but things are beginning to die down. I know some countries have experienced the second wave, but the number of cases are beginning to go down. There is a bit of hope. There is a flicker of hope. There is light at the end of the tunnel. We begin to see that things are beginning to change, and slowly by slowly, we're going back to our normal activities. So just want to thank you for listening to this video. This is quite a long video, but I just had to communicate all these things because these are things that I've been kind of ruminating on, things that I've been thinking about throughout the pandemic, and important lessons for humanity that we should not take for granted. So thank you so much for listening to me, and see you next time on the Success Portal. Goodbye.